Acne scars. I often get asked to recommend treatment for acne scars and creams for acne scars. So in this video, I'll tell you what are the principles for acne scar management and all the possible treatment options available in India for acne scars. So let's get started. First, how to treat acne scars. So whenever there is a scar, we have to cause some kind of remodeling, some type of injury so that there is new cells that come under the skin and make collagen. Okay, so that is the principle behind most of the treatment. It is to cause some kind of controlled injury to the skin so that new collagen gets formed. So keeping that in mind, we formulate and devise acne scar treatment. So the type of treatment depends upon multiple factors like how severe your scars are, what are the type of scars that you have, what is the depth of the scars that you have, and what is your age. So all these factors then helps us in deciding which treatment option will be best. So today I will tell you all the treatment options available and which suits what type of scar. So then you can just discuss this with your dermatologist so that you can make a better decision about your acne scar treatment. So first are creams. Tretinoin and tazarotene creams can help in improving acne scars. These are strictly prescription based creams, should absolutely not be used without prescription of a dermatologist. I have a detailed video on how these creams work, how to use it. I'll be linking that video in the iCard above. If you want more details about this cream, you can click on it to watch. But remember that creams cannot improve the scars completely. It is only helpful for very shallow scars. You need to use it regularly at night for up to 6 to 9 months in order to see improvement, and only the textural change and shallow scars improve if you have deep scars or scars that are visible from at least 2 feet away. Then they are not going to be improved with just use of creams. But creams are good to kind of boost the collagen synthesis. Along with other treatments, we also put you on creams to maintain the results and also improve the results. So for those reasons, tretinoin and tazarotene creams can help. Second treatment is a very popular treatment, which is chemical peeling. Okay, so we do chemical peeling for scars. So how do they help? By shedding the overlying dead skin layer, it tends to improve the skin texture, superficial scars improve, and also it stimulates new collagen formation. So there is an improvement in an overall skin texture. So what are the peels that we do? We commonly do glycolic acid, salicylic acid, retinol, mandelic acid, lactic acid, arginine peels in cases of acne scars. How does it work? Basically, it causes a controlled injury to the surface of the skin, sheds the overlying dead skin layer, and exposes the fresher looking skin, which is more smooth and more even in texture, and that is how it improves the appearance of scars. Which type of scars will respond? If it is visible only in certain angles and only under certain light, then that can improve with just a few sessions of chemical peeling. How many sessions are required? This depends upon the depth of your scar. Usually 6 to 8 sessions are required. These sessions are given 2 to 4 weeks apart. Once you achieve the desired result, maintenance can be done once every 3 to 4 months. You can go for a session of peel in order to maintain the improvement in your skin texture. What is the gap between sessions? We have to give a minimum of 10 days gap between sessions. Usually it's 2 weeks to 4 weeks, depending upon what type of peel has been used, what is the concentration of peel used, and also how your skin has responded to the peel. What are the side effects? If done correctly, there are no side effects of this treatment. It is quite safe, but has to be done professionally. We have to know what peel we are using and at what depth the burn is going to happen. So if all that is taken care, it is a safe procedure and you can get it done. But I do not suggest using any of these strong peels at home, especially in Indian skin type. It can cause post-inflammatory hyperpigmentation, which can take a long time to get better. So it's always best to get it done professionally. What are the precautions to take? As there will be shedding of the skin, you have to make sure that you moisturize your skin well twice in a day, and also stay away from the sun as much as possible and apply a good layer of sunscreen even when indoors and especially when outdoors. Try to take an umbrella when you're going out. Try to wear full sleeves clothing if you've done chemical peel on your arms. Make sure that all the areas that has undergone a peel is covered whenever you're outdoors. This has to be followed for about 4 to 5 days. This way the healing will be better and it will not leave behind any dark spots, and you will see better results. Cost for a peeling session, this varies widely depending upon the type of peel used. It can range from 2,000 rupees a session to 5,000 rupees a session. Third is subcision. This is a process in which we break the strands that are pulling the scars down. So how does it work? By breaking the strands that are pulling the scars down, the scar will be lifted up, and then this will lead to an instant improvement in skin texture. This procedure is usually combined with laser resurfacing in order to get the best results. Which type of scar will improve the best? Box scar and rolling scars will show the best results. How many sessions do you require? Usually 2 to 3 sessions are more than enough. Depends upon how deep your scars are and how many scars you have. Usually 2 to 3 sessions should suffice. Gap between sessions, 1 month gap is required between the two sessions. Sometimes when you do deep subcision, it can lead to hematoma formation, that is collection of blood under the skin, and that takes about 4 to 6 weeks to completely fade. So in that case, we can repeat the session only after 2 months. What are the side effects that can occur? When done correctly, there are no side effects, but if you do over-enthusiastic subcision, then that can lead to large hematoma formation. What precautions to take? Avoid heavy exercises that day, and you can do icing over the area in order to reduce the swelling. What is the cost? Cost also varies depending upon the type of scars and the number of scars you have. It can range from 2,000 rupees per session to about 5,000 to 6,000 rupees a session. Fourth is TCA cross. How does it work? In TCA, we apply this very strong acid with a toothpick just in your scars. This causes a controlled injury to the skin and causes scar remodeling. So this stimulates the skin to make collagen, which can then fill up the scar. Which type of scar will respond best? Ice pick scars respond best. Ice pick scars are very tough to treat. Ice pick scars don't show improvement with even subcision and even with chemical peeling. So in such cases, TCA cross can really help. How many sessions do you require? Usually 2 sessions done about 2 months apart is enough to give you good improvement. The gap between sessions should be at least 4 to 8 weeks. What are the side effects? It can sometimes lead to hypopigmentation, which is white spots on the skin where there is complete destruction of the melanocytes. If done correctly in a controlled way, you do not get side effects and it is quite safe, but make sure that it is always performed by a qualified dermatologist. What precautions should you take? You have to make sure to keep the area moisturized and stay away from the sun as much as possible. As we are causing an injury or kind of a burn to the skin, make sure to keep skin moisturized and hydrated, and also use a zinc oxide sunscreen whenever you go out in order to reduce any kind of UV damage that can occur to the skin, which can leave behind dark spots. What is the cost for treatment? This usually costs anywhere between 2,500 to 3,000 rupees. Fifth is derma roller or micro needling. So this is a common procedure that is done for acne scars. This also causes a controlled injury to the skin and boosts collagen synthesis. This really helps in improving your scars. What type of scars will improve? Box scars and rolling scars show good results with derma roller and micro needling devices. How many sessions are required? Usually 4 to 6 sessions are required. Gap between sessions is 4 to 6 weeks depending upon how your skin is responding. Are there any side effects? If done correctly, this is quite safe procedure. It has to be done correctly with a proper pressure and proper depth. I usually prefer to do microneedling, not the derma roller. I feel the microneedling pen gives a better control to the depth and also doesn't cause tears on the skin. So that device is preferred. What are the precautions to be taken? Like other procedures, you have to make sure to moisturize your skin well and stay away from the sun. Cost per session of microneedling ranges between 3,000 to 4,000 rupees. Sixth is lasers. Lasers can be ablative, that is which burns the surface of the skin, and non-ablative, which does not burn the surface of the skin. The ablative lasers, which are the fractional CO2 and erbium YAG, are very commonly used, and the fractional CO2 laser is considered a gold standard for treatment of acne scars. It causes injury to the skin in a controlled manner in microthermal zones, meaning that it causes very tiny micro injury to the skin, which goes to a depth of about 3 mm, and this then chars and sloughs off, and this stimulates the skin around this area to form new collagen, and this lifts the scar up. This can give a good improvement to your acne scars. What type of scars respond to this treatment? Usually all types of scars respond to this treatment. If they are very deep ice pick scars, then you might require a subcision along with this, or a TCA cross along with a fractional CO2. Otherwise, fractional CO2 improves all types of acne scars. How many sessions are required? Usually 4 to 6 sessions are required, and gap between sessions is 6 to 8 weeks. What are the side effects? It can leave behind dark spots if proper precautions are not taken and if very high energy is used. Otherwise, if you follow all the precautions, it is quite safe. What are the precautions to be taken? You have to stay away from the sun strictly for about 7 days. Use a moisturizer twice in a day and apply a plain zinc oxide sunscreen every 2 hourly. during the daytime. Okay, so this is very important. During fractional CO2 laser sessions, you have to practice strict sun protection and keep your skin moisturized to get good results. You are not supposed to pick on the skin, try to remove the scab, or try to peel the skin off. This is absolutely prohibited, as this can delay wound healing and also increase the chances of dark spots. A session of fractional CO2 laser can cost anywhere between 3,000 to 5,000 rupees. Then the seventh is microneedling radio frequency. This works on similar principle of microneedling, but it also gives heat. So along with friction, there is also heat induced energy to the skin. So the results are definitely superior to just plain microneedling. So what type of scar will improve? All types of scar will improve with microneedling. A combination of microneedling and CO2 laser works best if you have multiple scars of varying depth. How many sessions are required? Usually 4 to 6 sessions are required, and gap between session is 6 to 8 weeks. What are the side effects? Actually, this causes the least amount of side effects, but if very high energy is used, then tramp marks can be visible. What are the precautions to take? You have to stay away from the sun for about 2 days after the procedure and make sure you moisturize the skin properly. Cost for a microneedling RF session ranges from 5,000 to 8,000 rupees per session. Eighth treatment is plated-rich plasma therapy. This can be done as a solo treatment or in conjunction with microneedling, with fractional CO2 or microneedling RF. So how does it work? In plated-rich plasma therapy, we take blood, we put that in a machine, centrifuge it, and take the plated component and then inject that into the skin. This plated-rich component contains a lot of growth factors which can actually stimulate the cells to make collagen. This improves skin texture and also helps in improving the appearance of scars. So PRP sessions, usually 4 to 6 PRP sessions are required at an interval of 4 to 6 weeks. Precautions to take are similar to the other ones I've mentioned before. You have to moisturize your skin and stay away from the sun. Cost for a single PRP session ranges from 4,000 to 7,000 rupees. Ninth method is fat grafting or dermal grafting. In this, a small piece of fat or skin is placed under the skin to fill the defect that has been left behind by the acne scar. You require only one session of this procedure. It has to be done in an OT setup by a trained dermatosurgeon. Side effects could be sometimes lumpiness if it is not placed correctly. What are the precautions to be taken? You have to avoid any kind of heavy exercises for the next 4 to 5 days and allow this to heal completely. Cost for fat grafting can range from 10 to 20,000 rupees. 10th is punch excision or punch elevation. This is done in severe scarring where we feel that just with laser treatment it's not going to fill up the defect. Then what we do is excise the scar and stitch it up. So that way the defect will be sealed, and also there will be a very thin scar present which will not look as deep and as wide as the existing scar. So this is usually reserved for cases where there are multiple deep scars and scars which we feel will not improve with lasers. Usually only one session of this is required. It can be combined with PRP. You need to stay away from the sun. What are the side effects? When done correctly, there are no side effects. Precautions is that you have to keep this area sterile, and the stitches will be removed after 7 days. So you are not supposed to use anything over this area for the first 7 days. You have to apply an antibiotic ointment over this area in order to reduce the chances of bacterial infection. And cost for punch excision and punch elevation can range from 5,000 to 15,000 rupees, depending upon the number of scars that are removed. So which is the best treatment? There's no single treatment that can treat all types of scars. We usually have a multimodal approach wherein we try to use different modalities in order to give the best results. We can combine a fractional CO2 laser with a microneedling RF and PRP in order to give good results. In severe cases, we might have to go for fat grafting and punch excision or elevation. So in this way, by combining different modalities, we'll be able to give best results. The decision on which modality will suit you best will be taken by your dermatologist after assessing your skin and after seeing what type of scars you have and the depth of scars. That will help in deciding which modality will suit your skin best. So there you go, a detailed video on acne scarring and all the modalities that are available. The price point can vary depending upon which city you are in, which area, and also on the experience of the surgeon who is operating. If you like the skin and hair related content, you can follow me on my Instagram handle, Dr. Aanchal MD, where I post the skin and hair related content daily. Thank you for watching.